Life happens. Attitudes can change. Difficulties can be overcome. Rise with us. Bounce back with care. Bhanu and her daughter were abandoned by her husband when he learned about her irreversible kidney failure. He remarried and he never looked back. Preeti, mother of a 20-year-old son, was also abandoned by her husband when she was diagnosed with stage 3 kidney disorder. She had her father and brother to lean on. But despite their best efforts, they couldn't afford the treatment beyond a point. When Selvi was diagnosed with kidney disease, her daughters became pillars of strength.
Mary!
But the financial support they needed for her treatment was missing. They had no support from their father, who did not earn much and was not interested in helping anyway.
ಆಸ್ಪತ್ರೆಗೆ ಅಂತ ಹೋಗಬೇಡ ನೀನು. ಸುಮ್ಮನೆ ದುಡ್ಡು ಸುಲಿಗೆ ಮಾಡ್ತೀರಾ ಜನ. ಅಯ್ಯೋ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಕೇಳ್ತಾ ಇಲ್ಲ ನೀವು.
Her daughters took it upon themselves to handle their mother's stage 3 kidney disorder. They did this by taking up lucrative jobs and managing the situation well. Women are commonly discriminated against, undervalued, disregarded, passed over, and mistreated in society at large. We see this in education, the workplace, and even within families. When resources are limited, the health of women, the caregivers and nurturers, becomes low priority. Selvi had decided to ignore her condition as it meant an impossible financial commitment. Her daughters, however, did not give up.
We were introduced to Adhyan through Bangalore Kidney Foundation when our mother was diagnosed with kidney failure. The treatment cost was coming up to 15,000 per month, and that was something we couldn't afford. Since then, Adhyan has been picking up all the bills. It's been a year so far, and not just Adhyan has been helping us with the bills, they've also been giving us protein powder, supplements, and even helping her with all the counseling sessions.
To begin with, our gratitude to Adhyan Trust for the support towards 20 women dialysis patients who are all from the marginal income strata. These patients generally do not undergo regular dialysis, and if it's dialysis, they don't have nourishment. So it's a big thing that Adhyan has come forward to meet their nourishment requirements, and BKF has stepped in to give them dialysis support. With this combination, most of the patients, women patients, have now become self-sufficient in most of their activities. They are good to go back to their work. Many of them are useful in their domestic chores. Very little percentage of sickness and hospitalization. And their SGA results are all very positive. With regular dialysis, they have made their lives more meaningful and a life worth living.
Adhyan was started to support vulnerable women and children. We believe that when women are cared for, they bloom. So do their children, families, and communities.
ಮೊದಲು ನನಗೆ ಈ ಸಮಸ್ಯೆಯಿಂದ ತುಂಬ ನಿರಾಶೆ ಆಗಿತ್ತು. ಏನಪ್ಪ ಇದು ಜೀವನ ಅಂತ ಆಗೋಗಿತ್ತು. ಆದರೆ ಈಗ ಹಾಗಿಲ್ಲ. ಬದುಕು ಚೆನ್ನಾಗಿದೆ. ಯಾರೋ ಒಬ್ಬರು ನಮ್ಮ ಬಗ್ಗೆ ತುಂಬ ಕೇರ್ ಮಾಡ್ತಾರೆ, ನಮ್ಮನ್ನು ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಳ್ತಾರೆ ಅಂದರೆ ಅದಕ್ಕಿಂತ ಸಮಾಧಾನ, ನೆಮ್ಮದಿ ಇನ್ನೇನು ಬೇಕು. ಆದ್ಯನ್ ಸಂಸ್ಥೆಯವರು ಆ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ನಮ್ಮ ಹತ್ರ ಯಾವೊಂದು ಎಕ್ಸ್ಪೆಕ್ಟೇಷನ್ ಇಟ್ಕೊಳ್ಳದೆ ನಮ್ಮನ್ನು ಅಷ್ಟೊಂದು ಕೇರ್ ಮಾಡಿ ನಮ್ಮನ್ನು ಒಂದು ಹೆಲ್ದಿಯಾಗಿ ನೋಡ್ಕೊಳ್ಳೋದಕ್ಕೋಸ್ಕರ ಎಷ್ಟೊಂದು ಸಹಾಯ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ನನಗಿದು ತುಂಬ ನೆಮ್ಮದಿ ತಂದಿದೆ ಜೀವನ.
Life happens. Attitudes can change. Difficulties can be overcome. Rise with us. Bounce back with hope. Sometimes, help at the right time can make all the difference. For children born with congenital heart defects, timely surgical intervention can change destinies. At Adhyan, we believe that we can create hope. 10-year-old Bhaskar needed corrective heart surgery. A first corrective surgery had failed, leaving him in poor health and his parents desperate for a solution. Destiny favored them when Dr. Driani Joseph, an expert from Mayo Clinic, and Dr. Vijay Kumar from G. Kuppaswamy Memorial Hospital in Coimbatore took on Bhaskar's case. They performed the complex surgery successfully. Bhaskar got a second chance at life. 10-year-old Padma was born with a rare heart condition called tetralogy of Fallot, also known as the blue baby syndrome. Weak and underweight for her age, Padma's skin always had a bluish tint due to the lack of oxygen. Her condition was grave. The response from every doctor was the same: no hope. But her mother, a sole parent, did not give up. Determined that her daughter should not just survive but thrive, she continued a tireless search for a medical solution. Her quest led her to Dr. Vijay Kumar, and the rest is history. Today, Padma is healthy and happy, just as her mother had once wished for her to be.
ಈ ತಾಯಿಗೆ ಮಗಳು ಬದುಕುಳಿತಾಳೆ ಅನ್ನೋ ನಂಬಿಕೆನೇ ಕಳ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ಲು.
ಆದರೆ ಈಗ ನೋಡು,
ಪಾಪ ಏನೇನೆಲ್ಲ ಅನುಭವಿಸಿದ್ರು ಅಮ್ಮ ಮಗಳು.
We at Adhyan honor the grit and faith of Padma and her mother. They are the reason for our mission to give children born with heart defects a new lease of life and their parents a reason to hope.
So far, we have performed around 40 children from underprivileged families, and all of them did very well with open heart surgery, and all of them are doing very well. I sincerely thank Adhyan Foundation and the entire management of Adhyan Foundation for their extensive support to the needy children from underprivileged communities.
Many of them need intervention, surgery or otherwise, and unfortunately in India this can cost between 1.5 to 5 lakhs. I have been working with Adhyan to help identify these children and certify that they do need intervention, at which point Adhyan takes over with the funding. I must say, for children with heart disease and for their families who are so anxious and worried, having a foundation like Adhyan is really a blessing.
Life happens. Attitudes can change. Difficulties can be overcome. Rise with us. Bounce back to freedom. Give women freedom to make choices for themselves and their families, to explore opportunities and develop skills, to work towards financial security. Give women the support they need and see how they thrive. This is Adhyan's founding belief. When a woman is truly empowered, we see the impact trickle down to her family and her community. This applies to women from any strata of society. Meet Radha, a working woman and mother to a child with dyslexia. Radha recently separated from her husband and is now raising her child all by herself. Her single income must go a long way to cover household expenses and her daughter's education, including special therapy sessions.
ಹಲೋ ಅದೇ 12 ನೋಡಿ ಗ್ರ್ಯಾಂಡ್ ಬಜಾರ್ ಕಾಣಿಸ್ತಾ? ಅಲ್ಲೇ ಬಿಟ್ಬಿಡಿ. ಸೆಕ್ಯೂರಿಟಿ ಹತ್ರ ಸಾಮಾನು ಸ್ವಲ್ಪ ಇಟ್ಕೊಳ್ರಪ್ಪ. 1 ನಿಮಿಷ ತಾಳಿ, ಕಾಲ್ ಮಾಡ್ತೀನಿ, ನೀವು ಇಟ್ಕೊಳ್ಳಿ. ದೀಪ್ತಿ, how are you? I know we were supposed to meet now. Let's connect in 10 minutes on Zoom. That works. All right then.
While juggling all these responsibilities, she also needs to care for her own mental health with counseling. Only then can she be present for her child. It's not easy.
Hey, hi Deepthi. How are you today?
But she keeps going.
Shall we begin? When Adhyan came into my life, I was struggling mentally, emotionally and financially. I was overwhelmed with a lot of responsibilities that I wasn't prepared for. They helped me, encouraged me and enabled me financially, which helped me get on my feet.
Radha's story is more common than you'd imagine. There are countless women, abandoned, separated, or widowed, who find themselves suddenly alone, with families to care for, bills to pay, and emotional trauma to overcome. They must strive to make ends meet while learning new skills and raising their families. All this while navigating the challenges of their new reality. That's where we step in. We believe that financial empowerment is the key to women's freedom.
The program that Adhyan is supporting is called wecare. It's a comprehensive MBA for rural women. Women are gathered in cohorts, women who are interested to become entrepreneurs. They go through financial literacy sessions, how to balance life and business, how to identify the right customers, make a business plan, make up a goal for themselves, and also do a SWOT analysis of their potential business. And it's a knowledge and skill building exercise for potential women entrepreneurs. And the idea is that once the capabilities are built, the women will be able to become entrepreneurs, support themselves, support their families, and of course the society.
Maunadhwani helps women in rural Orissa find livelihood security through textile craft.
Adhyan Foundation came into our lives at a very critical juncture of the Maunadhwani journey. We had just completed about 3 years in the village, engaging with the community, working with the women, understanding their craft, their culture, creating those 5 initial centers that we had created in the 5 villages around, and taking the women through a journey of being absolute novices in the craft, just entry level, to then moving them into experts. So word had got around, and that's when the women of Kanapur came to us and they said, please start in our village too. Now, starting a center is not easy because in those places you need to start from scratch. But the women said, don't worry about the infrastructure. There is a dilapidated school in our village. We will approach the authorities. We will get all the related permissions and get all of that done. We will also complete the registration. We will get the community together, make a list of the women, get all of that done for you. Now, this was a pleasant change for us, and just to see the enthusiasm and the excitement of the women and their drive in getting this done. And then it was our turn to keep the promise. And that's exactly when Adhyan Foundation approached us, and we got a call from them. And then with a few dialogues, they confirmed that they would handhold the Kanapur Center. When I got that call, I relayed the news to my team and the women, and it was a day of joyous celebration.
नमस्कार, मो ना होची गौरी मुर्मू, आम घर होची तुलियाबसी। एठी आमे 2018 मसियारू ट्रेनिंग नेले। जेतेल मु झियो थिनी, छुआ बेले देखिथिनी आम गाँव रो बुणाबुणी करूथिले। आगुरु तो आमे एमती जानिथिले नेडा कोन बुली जानिथिले नि जिनसटा कोन एडा कोन हला काई आगुरु तो एठी सेठी आमे काम करथिले गाँव रो बाहर बिलवाड़ी काम करे एते आउ जानिने। जेतेले मोहनधनी आसला फाउंडेशन मोहनधनी फाउंडेशन जेतेले डाकिले आमको एठी जोगाजोग करिया पई ट्रेनिंग नेले। ट्रेनिंग नै कि गामछा बुनले फास्ट, तापरे स्टॉल, साड़ी, बैग ये सब बुनले। जेतिको जहाँ भी मोहनधनी आमको जेतिको रोजगार आमे करछे कारी पाखरा आ हाथ पतौने आमे निज रोजगार निजे चलुचे। आगु जेतेले बापा माँ को मागुथिले दियो आमको खर्च, एबे आउ मागुने आम निज रोजगार निजे करि पारुचे।
This has had a ripple effect on the community, lifting families out of poverty and creating economic prosperity and social well-being. It all begins with support for the well-being of women. That is Adhyan's purpose. Life happens. Attitudes can change. Difficulties can be overcome. Rise with us. Bounce back with belief. Children are capable in their own unique ways. Instead of labeling them, what if we met them where they are and built on their strengths?
Hey, look, is that Prashant?
The way the teachers and parents in their lives respond to children who face learning difficulties determines the outcome. With acceptance and a positive attitude, they learn. With training that taps into the brain's neuroplasticity, its ability to adapt and build new neural pathways, cognitive functions can be enhanced. The result? Children with learning difficulties become lifelong learners. Adhyan supported an initiative to make school education responsive to children across learning abilities and styles. A resource group on inclusive education, the Teachers Collective, was invited to train teachers at Sadhu Vaswani International School, Bengaluru. The goal? To ensure that no child gets left behind in a general classroom and that children with learning difficulties find support early on.
So we don't believe in children coming to the resource room unless it's like really required, and we believe in that tier approach, that if 85% of the needs of the children are met in classroom, then only 15% of the children need specialized support, and those who can't can come to the resource room. So our model works in such a way that if we equip teachers to work with all children, then children don't need to be pulled out of the classrooms, and that's the spaces we want to create. So our inclusion at project at SVI is for the next 3 years, build in developing these ecosystem that after 3 years the school is strong enough to take it up themselves, and we are kind of redundant, and we move on to another space to make a difference to another community. So we thank Adhyan for giving us this opportunity and bring this project live in spirit and make it more meaningful for the community.
Millions of children in India grow up with developmental challenges. There are, however, very few pediatricians who specialize in identifying developmental delays and providing appropriate support. Adhyan is helping change this in partnership with Latika, an NGO based in Dehradun. The Adhyan AIMS Fellowship has been created to grow the tribe of developmental pediatricians in the country so that children who need it can have access to early intervention.
When we first proposed the idea of establishing a fellowship in developmental pediatrics to Adhyan, we expected to go through the usual long process of convincing them that this was important. But we were amazed by how quickly they agreed to do it. And what we've learned is that Adhyan's vision is the same as ours. Their vision for equity and inclusion is so clear. And one of the things that's missing in the landscape for children in India are enough competent pediatricians who know how to diagnose a child with a developmental delay. You need developmental pediatricians for that, and there just aren't enough of them. And the only way to create them is to train them. And that's what this fellowship is about. So it was not a hard sell with Adhyan. They got it immediately. It fit with what they wanted to do, and they have made our lives so much easier as a result. This 1-year experience of partnership with Adhyan has been a real joy, and we don't get donors like this all the time. They are so in sync with what we are trying to do. They have the faith and the commitment and the capacity to make it happen. So we're very proud to be part of the Adhyan family.
Hi, I'm Dr. Ikra Khan, and I was working for the past 1 year as fellow in neurodevelopmental and behavioral pediatrics at Latika. So as we know that pool of developmental pediatricians in India is very small, very scarce. Many of us are not very accustomed to this different term called developmental pediatrics, and many of our parents are not very aware of it. So Adhyan, in collaboration with Latika, started this very unique, very novel fellowship where I personally was very fortunate to be learning different approach, that is the family-centered approach, where I was able to provide not only the medical treatments, but I was also a part of the educational model where I was working with special educators, psychologists, speech language pathologists, and physiotherapists.
At Adhyan, we believe that education that caters to neurodiversity tells children with learning difficulties that they matter and that they have potential. It makes them believe in themselves and gives their families confidence. It also provides the support they need to overcome their difficulties and succeed. That is, after all, the goal of education.